So I'm here with Hazel Oliver today. Hazel has agreed to come and talk to us about her diagnosis and also what followed the diagnosis, which is how she got back into the normal swing of things. But we will talk about that in a bit. But let's talk about the initial period, the early period, that difficult time when you were heading towards a diagnosis, but you weren't maybe sure what was going on. What were the first symptoms that came along?
The first symptoms I had was noticing that my eyelashes were touching the lens of my glasses and thinking something's not right here. Being sent off to eye casualty 2 days to get to see consultants, and then saying we can't find out what this is, we don't know, we think it might be thyroid, it might be something else, we'll get some scans done. Get scans done, the whole process took a week, and then you see the consultant to say, actually you've got a tumour. It's a meningioma, it's there, and it's the shock is absolutely enormous. To tell you what it is, to tell you normally that they wouldn't do anything, but because this was affecting the sight as well, with some double vision, go, so what happens? It's just horrendous going through that. The initial shock of being told, going away, having a damn good cry, and seeing what you can do, and then thinking, well, okay, I'm affected, what's it going to have with the rest of the family? How's it going to affect them? Coming to terms with that is extremely difficult. You have to sort of pull yourself together and just tell everybody.
Now, how do you think that process was handled by the medical profession at that time?
There was very little on the explanation. There was virtually nothing on the way of support to get through that initial process. The whole going from that initial diagnosis in January through to having the operation to remove the tumour didn't happen until July. That is a long time. There were lots of delays en route, but there was no backup and support to this is what it's going to be. It wasn't until you actually go in to have the surgery done does anybody sit down and tell you what some of the side effects might be, but they don't tell you the whole of it. That is a case of find out for yourself. That is hard.
So really, you're saying that medical information could be either better organised or more comprehensive from an early stage?
From an early stage, it needs to be very comprehensive. You need to know the risks that, yes, if you're having surgery to your head, to your skull, there is risks that you may end up having fits, you may end up not coming through this at all. Those side effects, yes. What they didn't point out was things like you're going to end up, you may lose the sight. That it was the whole point of the operation was to stop that happening. When you come out of the anaesthetic, it's a lot worse than anybody thought. The effects of actually losing part of your skull with subsequent ops, nobody goes through what that effect is going to be and people's reaction to you. That something needs to be there because it can be so hurtful and so people see somebody that's had a head injury or something, if they think because you've got an injury your brain's not working, so they're not going to talk to you, they're frightened of you. You have to make the first moves. But getting there is no.
Now, what would you say to the members of the medical profession, nursing profession, who say, well, I hear what you're saying about information, but we don't want to scare people, we don't want to give people too many negatives at an early stage?
There is a lot of attitudes on whether do you tell people, particularly with children, do you tell them what's going on? If you give them all the scenarios that could happen, if they don't happen, you can cheer. Because it didn't happen to me, I feel great. If it does happen, it's not something to be frightened. You're aware of it. you're then prepared, so it's giving you all the information takes away the fear. You deal with it. If it doesn't happen, you're so happy and perfect that you I've come through that without these things. If it does happen, you go, fine. But if you don't know, you are thrown into what am I to expect? What's going to happen? How do I deal with this? There's nothing.
Now, one side is information, isn't it? But another side, hopefully going hand in hand, is support. Support may be informal from family and friends, but it may be from healthcare professionals as well.
There needs to be the knowledge or the information there to where to go. If you need help, if you need support, what is going to happen? Who do you contact? There's two sides of me. Yes, there's tumour one side, there's facial palsy the other. Okay, there's a big gap. But neither have had any support at any time as to where to go. It's the consequences. It's dealing with families' reactions to you, comments from your own kids. I can't remember what my mum should look like. That's a knock-on effect. To go through brain surgery, from your family's point of view, they are completely worried and stressed out. It has an effect on them. Their ability to do anything, to go to school, it has effect on partner, on your husband. It's a knock-on effect for everybody, which nobody takes into account when you're in treatment, and it's not, there is no backup. It's very often go